In the meantime, the House of Representatives has launched a probe into the over $1.8 billion and $2.8 billion grant received by Nigeria from the Global Fund and the United States Agency for International Development, USAID, between 2021 and 2025 for the fight against HIV and AIDS, tuberculosis and malaria, as well as for strengthening health systems. Chairman of the House Committee on Infectious Diseases, Amobi Godwin Oga, in his opening remarks at the investigative hearing said the probe is to determine how the huge grant had been utilized and to ensure accountability in the management of funds aimed at tackling infectious diseases ravaging Nigeria. The Speaker, Tajuddin Abbas, represented by Honorable Ibrahim Isiaka, said the investigation reflects the Parliament's resolve to ensure transparency in health funding. It said it would produce an evidence-based report on how the grants were received, utilized, and their impact on public health, while strengthening accountability and governance in the sector.
Committee, with the amounts, with how it's been used, and they are mandated to disclose everything that the committee would like to see. The commodities that were procured and delivered, who has been delivered, who has been treated. Of course, there are sensitivities around who is treated for what disease. That is personal information, so that will be identified. But more than 1.5 million Nigerians on ARVs, they are identified and we know them. They are nationals and we want to continue to support them. And the network of people living with HIV is here as well.
It is within this context that it becomes necessary to ascertain what has been done with the huge grants received by the Nigerian from Global Fund and USAID for the response against these diseases from 2021 to date. We are aware that the grants received from international partners and donors agencies before now form 90% of the country's intervention and investment in the response against these diseases. Henceforth, we cannot continue to receive grants and aids that reduces us as mere spectators while the donors' countries spearhead the management and administration of those grants indirectly.
Health and Social Welfare, Dr. Mohammed Ali Pate, called for a gradual end to Nigeria's dependence on foreign aid in funding its response to HIV and AIDS, tuberculosis and malaria. He described the probe as a welcome step towards transparency, accountability and domestic ownership of health programs. He noted that while donor assistance has saved millions of lives through HIV, TB and malaria interventions, Nigeria's health spending remains below 15% of the Abuja Declaration target, warning that underfunding threatens sustainability.